of the fibrosis of interstitial fibrosis in a lung, normal lung, and maybe the early stage for a malignant transformation. No positivity in breast carcinoma, no positivity in urothelial carcinoma. And then we prepare some antibody for the choline, the variant 1, variant 2, because in our sequencing of this protein, we observed that there was a difference in 1 or 2 amino acids. And in this case, we have a negative result. And for the variants, 1 was negative also in myocardium. And there was a slightly positivity in for variant 2 of the choline. Then again, the histochemical expression by this antibody for the first epitope was stained in human adenocarcinoma, and this was the preliminary work that was carried out by the group of Rome, of Tor Vergata University, by Garaci, and they were able to show again about the compartmentalization of the antigen by immunofluorescence studies, and what was interesting enough to know that the same results were at the same time obtained in Pittsburgh by the group of Dr. Heberman. We gave this specific anti-serum to Billy Yoon at the University of California Cancer Center in San Francisco, and then by microarray was obtained an interesting profile of the activity, especially for what is concerning the specificity with a normal cell, and a very, we say, pretty significant specific reactivity for lung cancer cell. So, I mean, this, of course, is very interesting if we think that now, this time, I mean, about to study for early diagnosis, and at the same time, about the antibody, there was, excuse me for the Italian, but in any case, these were original slides of Professor Bartorelli in Milano, in which he was able to show in different cell lines a cytotoxic effect of our serum, and this is a control, and this is after, I mean, the interaction with the serum. And there were different lines that they show a different percentage of cytotoxicity. So we can, at that time, conclude that this tumor-like protein is measured in blood and tumor tissue. And so it could be a diagnostical tool to monitor the response of patients to therapy. At the same time, can be used to stimulate the cells of the immune system for treatment of cancer patients, or as the people in Rome showed for the colon cancer patients, both the symptomatic origin. And this, of course, would be more interesting if, in perspective, we can think to develop a vaccine for the treatment of these patients. And the day before yesterday, we gave some preliminary results in experimental rats and in a few human beings. Now, for the present studies of this session, we will want to talk a little more concerning the antibody for early diagnosis that the study was done in different places, in Italy and other countries. But it's interesting the possibility to purify and to have recombinant protein. Some of the earliest results I gave this morning at the other meeting on